Hello, my name is Lindsay Riley. I am a student occupational therapist at the University of St. Augustine. Today I am going to be discussing with you a medication management intervention plan for diagnosis of narcolepsy, but also the client has comorbid hypertension also. So there's 3 different medications that I'm going to be discussing. The first 2 are specific to narcolepsy, and the last one is a hypertension medication. So just a little brief background. The first one with regard to narcolepsy is called Provigil. The purpose is to improve wakefulness. Some of the side effects include a serious rash, allergic reaction, some mental symptoms such as delusions or hallucinations, symptoms of a heart problem such as palpitation or chest pain, and trouble breathing. The next medication that is specific to narcolepsy is called Xyrem. This one actually has a couple of different purposes that it serves. It addresses the EDS, or excessive daytime sleepiness, that occurs with narcolepsy, and also addresses a phenomenon called cataplexy, which is sudden, weak, or paralyzed muscles due to, it's triggered by a strong emotional response, such as laughter or anger. And some of the side effects of this medication include breathing problems, such as slowed breathing or sleep apnea symptoms, confusion, hallucinations, and sleepwalking. So the last medication is called Zestril, and as I said previously, this is the hypertension medication. And some of the side effects include dizziness, decreased urination, swelling, rapid weight gain, flu-like symptoms, psoriasis, and persistent cough. The precautions of these medications that I just discussed are as follows. Xyrem and Provigil are both considered controlled substances due to their risk of dependency. You should take Xyrem 2 hours after eating, and Xyrem can cause an individual to fall asleep very quickly within 5 to 15 minutes. Therefore, they should be in bed when taking this. You take this at night. It's a nighttime medication, so they should be in bed for both doses. Don't take Xyrem if you're taking any other sleep medicines or sedatives. Don't drive, don't operate any heavy machinery, or participate in any other activities that require full awareness and for you to be fully awake for at least 6 hours following taking your dose of Xyrem. As far as the hypertension medication, it may increase potassium levels, therefore you should always consult with a doctor before starting any supplements. Older adults may also be more sensitive to this medication, and this medication is not recommended for children under the age of 6. My client is a mother of 2 children. She's employed as a secretary and suffers from narcolepsy and comorbid hypertension. So, addressing the routine part of the intervention, as her OT, I would first discuss with her about getting in the routine of taking her medications and combining this while she's doing her daily morning self-care routine, such as brushing her teeth or washing her face. So combining these 2 activities would provide more structure, and the client would be more efficient in taking her medications, which would be ultimately promoting successful medication management. For the habit area of the intervention, so I would discuss with her about keeping her medications all in one specific area, such as on the bathroom counter, so that while she's doing her morning care routines, it's right there in front of her so she can't really forget about it. Also, in addition to this, I would suggest a pill organizer for her bathroom counter to make this even easier. I would educate and demonstrate with the client on how to sort the pills and put them in the correct day before the start of each week, so that this should become an automatic habit for the client to do. It also would serve as a visual aid for her to be able to see that she has in fact taken her meds for that day, for the correct day, and versus just keeping them in a bottle on the bathroom counter would, she wouldn't, if she didn't remember if she took them that day, there wouldn't be any way for her to see, versus the pill organizer is a visual aid that would help her to actually see. So if the client is also establishing a habit of keeping her meds consistent in one area, this will cue her, like I said before, it'll cue her each morning as she's completing her self-care routine. So if it's sitting there on the counter, this will serve as a cue. So it's kind of just a two-in-one thing. It's a reminder. It's a reminder, and it helps her to see if she has taken the pills for that day, if she would forget. So when talking about context, I would discuss with her how not taking her required medications would influence her state in both social and physical environments. So for example, if she was out with a group of friends, how would this affect her behavior, and also the implications of this while at work as a secretary, or how not taking her meds would affect her in completing daily tasks at home. So ADL tasks at home. So if the client were also to go out of town, there would need to be a discussion on kind of how to address this, and I would instruct her to maybe buy, first to find out if she's able to get her prescriptions filled early so that she's, won't run out while she's gone. She has the guaranteed amount for the time that she'd be on. And also maybe to invest in buying just a couple extra pill organizers so that she's able to sort out the pills, the number of pills that she would need for the amount of time that she's gone. So it's already all done for her, and she wouldn't have to worry about doing it while she's out of town. So I would also instruct her to keep up the same routine of keeping the pill box on the bathroom counter of wherever she is, and also to keep combining taking her meds every morning with her daily self-care routine. And that is my intervention plan for narcolepsy and medication management. Thank you.